Hello and welcome to our program. Cancer as a disease today seems to have invariably walked into most of our lives today, whether it's through family or extended family. We all seem to know somebody who has had or still has cancer. So how are we learning to understand and handle the dreaded C word? Where are we placed in terms of policy, attitude and advocacy for this disease? We'll talk about all that and a lot more in our program today. Please welcome Dr. Bhawna Sirohi, cancer specialist. Dr. Bhawna, welcome to our program.
Thank you so much for having me on the program as well.
You know, you bring a very unusual understanding of cancer because you have worked extensively in India and outside India. And you're seeing actually how cancer is morphing today more into a lifestyle disease and something that people are living with, getting cured and handling well. And there is a certain optimism when you talk of cancer. Let's start with that.
Yes, you're right. Having worked in the West for more than a decade and working here in India as well for the last 5 years, I started my cancer journey in India in 1994 and trained in India for 4 years and then went to the West and then came back. And you're right in saying that I hardly knew anybody who was touched with cancer within my social circle, family circle. But now I have friends, family who've been touched with cancer. And there is a fear. There is, like, I was doing a camp in a village. One of the villagers said, "Aapne to hamare ghar mein bomb chhod diya." You know, so they are very, everybody's scared of the word cancer. My grandmother had cancer. And my mom, मौसी जी, मामा जी, everybody said उनको मत बताना कि वो मरने से पहले मर जाएंगी अगर तुम उन्हें बता दोगे कि उन्हें कैंसर है. So you know, this is, I'm talking of a rural and urban setting. Both the places, everybody is very scared of the word cancer, and that is correct in a way because, you know, when earlier we were treating cancer, it was being diagnosed in advanced stages. And most patients were not cured if you're diagnosed at advanced stages. But now we are becoming more and more aware about cancer, and it is being diagnosed early, and we are able to cure more and more patients.
Right.
So you have diabetes, you have hypertension, which you're never able to cure. You know, if you have diabetes, you have it for life. It's a chronic illness. Cancer, if you diagnose early, in early stages, you know, it has 4 stages. So if it remains within the organ, then it's stage 1 to 3. But if it goes out of the organ, say it goes from the breast to the lungs or liver, it becomes stage 4.
Right.
So in that stage, it is not curable, but still it is treatable. And a lady with breast cancer, with stage 4 cancer, which is hormone driven, can live for 10 years. A very good quality of life.
Okay.
So you have 2 scenarios. You have early stage cancer, which can be cured, and you have advanced stage cancer, where in some cancers you're able to cure them or actually lead a completely normal quality of life.
Which is what we call palliative care?
Palliative care is something different. Palliative care encompasses a whole body of things, you know. Palliative care does not just mean end of life care or care of the dying or care of stage 4 patients. It means that, you know, you're able to control the symptoms related to cancer, let's say vomiting, constipation, diarrhea. All these are symptoms of cancer and also of cancer treatment. So palliative care encompasses everything. And in India, actually, this is a very good thing you brought up, that we need palliative care to come in early in cancer patients,
right,
rather than late, because, you know, it makes your journey of cancer smoother and you enjoy a better quality of life.